So I want to talk about the trans care ban ruling. And opponents are saying that that's going to strain the healthcare system and harm patients. What's your response to that, Governor?
It is the mutilation of minors that is harming people. It is wrong to do this. You do not take some 14-year-old and pump them with hormone blockers and try to change their sex with an operation. It's wrong. People that have gone through that, there's so much lasting damage that has happened. It's not based on sound science. And in fact, most of these countries in Europe that are more liberal than the U.S., like Sweden, they have pulled the plug on this. The United Kingdom pulled the plug on this. So what we did is protecting young people. And here's the secret on this. There's a lot of people that make money on these surgeries. That's why it's going on. You'll have a parent, look, when you're at that age, that is a tough age. There's a lot of things that happen. And so as a parent, it's not easy to navigate that. I mean, I think anyone can appreciate that. I mean, mine are a lot younger than that, but it's like I know once you get into that. And so, you want to be able to help your kid. And so you'll go to a doctor will say, this is what you have to do. You have to do this surgery to try to change their body parts. And that's based on junk science. It's based on ideology. It's causing a lot of damage to folks. And what we did was put a stop to it in the state of Florida. We're not going to be a cottage industry for the mutilation of minors. That is not happening on my watch. And what we did by doing that is to just recognize, I mean, how would we possibly say as a state that you cannot have a tattoo at age 14. You would not be able to go sit at a bar and drink beer at age 16. Even with your parent, you wouldn't be able to do that. But somehow you could have these mutilation procedures where they're trying to change your body parts and try to change your sex at age 15 or 14. How is it? And because it's obviously inappropriate in those other situations, of course it's inappropriate here. Now, we had a judge initially say that was somehow unconstitutional to not allow, which, first of all, that is like no one would have said that it was unconstitutional even 10 years ago. It conflicted with what the 11th Circuit had already done, which is our federal court of appeals that covers Florida, Georgia, and Alabama. Because they upheld Alabama's law that was very similar. So we knew on appeal that we would win. We were able to win that, and so that's going into effect. But that is going to provide protection for people in very vulnerable situations. We are not going to let these people who make a lot of money off doing these things be able to do that. And you know what happens is they do a procedure at age 15. A lot of the dysphoria that happens with young people resolves itself by the time they become 18 or 19. That's like 80-some% of the cases. Why would you do these irreversible surgeries when it's likely to resolve anyways? And so what happens is then they get older, they have huge problems. Some of them are sterile, get sterilized with this. Others have all kinds of other physical problems. It causes emotional problems. But these guys made money off it. You should be able to sue those people that are performing those procedures. I think that should be anywhere in the country. You should be able to sue for damage that is done, because I think it's a false bill of goods that's being done. And we're actually now finally starting to see courts produce or accept some of the evidence that shows that this is a bill of goods. And so I think it was a no-brainer that was upheld. It should be upheld, and I think that the United States is lagging behind many other industrialized countries. A lot of these other countries dabbled in this with the sex changes for minors, and they recognized that it was doing a lot of damage, that there was no solid evidence-based medicine to support it, and that they discontinued it. And so Florida, we're kind of one of the leaders here in the United States. Clearly, you've got big problems with the administration in Washington and how they view all this stuff. But, you are in a situation where, depending on how the outcome of the election goes, I could absolutely see a Harris administration try to wield the administrative state against states that have done things like we did to protect minors from the mutilation procedures, but then also even things like ensuring that you're not jamming the men in the women's sports. We've protected women's sports in the state of Florida. They have a right to compete with fairness and integrity. You can be someone, you're gonna swim on the men's team for 3 years, then switch to the women's team, and all of a sudden you're the national champion. People realize that's a total fraud, and it takes away opportunities for women. But I absolutely could see them trying to turn the screws on that. I mean, they threatened, when we first did our women's sports bill to protect women's sports, they threatened to withhold federal school lunch money from poor kids over this. And I'm just thinking to myself, you really want to see the boys compete against the girls so much that you're actually going to take away, you know, some of the school lunch money? I mean, it's just nuts. But a lot of it is motivated by ideology. It's not motivated by anything. And it's kind of a perverse view of so-called social justice, because you'll have people say, hey, you have this transgender athlete, usually a biological male who is identifying as a female, and they say it's justice that that person can compete against the gender that they conceive themselves to be, which, first of all, I don't really buy that in isolation even, but what about the justice for the 99.9% of the women athletes who now have to deal with this? Why aren't they ever consulted or considered on this? It's all about an agenda. Meanwhile, you've got a lot of people that have worked very hard, and they're left in the dust effectively on this. So, you know, I think that we just need to be right with what's true and factual, and we cannot get carried away by ideological agendas. And I think the medical industry, unfortunately, on this issue with the surgeries for the minors, you know, they've made a lot of money off it. The science is junk. But we also saw some of the nonsense they were spewing during COVID. You know, it's one thing to try to say something that you needed to do something, but when that obviously didn't work, you got to acknowledge it didn't work, right? I mean, to say that if everyone just wore a cloth mask for 6 weeks, COVID would end, which the CDC said, that was not true. And even when it was obvious that wasn't true, they kind of kept digging in. And so I do think that this issue of the surgery for minors is part of a larger issue where we've really seen the politicization of the medical establishment. We've seen the politicization of medical school education throughout this country. I think Harvard or Columbia, one of them, you know, they showed the medical school graduates taking the Hippocratic Oath. But it was basically like a woke Hippocratic Oath. It was talking about like race and gender and ethnicity and all this stuff. And I'm just thinking to myself, that is not how we used to train physicians, and yet you're seeing that seep in. So the state was right to do what we did. It's going to protect people. It's going to avert a lot of harm that's being done in other parts of the country. And legally, it was a no-brainer. This just is constitutional.